Hi, I'd like to introduce Chris White, who's the Group Chief Executive of the National Council for the Blind in Ireland.
Hi, I'm delighted to introduce Mark Cahill. Mark is a leading ophthalmologist in Ireland. He has 20 years experience of promoting better care and better services for people with wet macular degeneration and with diabetic retinopathy. Mark, many people haven't heard of wet macular degeneration. How does it affect your vision?
Well, the key sign of wet macular degeneration is the onset of distortion. And distortion is where straight lines become bent out of shape. And that's very unusual. That's very few things will cause distortion. And so if you start to see distortion, it's likely that it's due to wet macular degeneration. Wet macular degeneration can also cause a reduction in your central vision, and you can get the two together. You can get distortion and reduction in your central vision together.
Mark, people who've been diagnosed with wet macular degeneration might not have heard of it before, and they might be concerned or worried about the impact it would have on their independence.
Well, wet macular degeneration will affect your independence if it's not treated. And we know that because when I started in eye medicine, we didn't have treatment for wet macular degeneration, and over time, it reduces your central vision to the point where you're legally blind. When your central vision is reduced, that means you can't drive, you can't do normal day-to-day activities like picking out clothes, doing things around the house, and you can't recognize people. The good thing is with treatment for wet macular degeneration, you can prevent central vision loss if you have regular treatment, and so you maintain your independence.
So wet macular degeneration is affecting one eye. What's the likelihood or predictability that it would affect both eyes?
Well, wet macular degeneration affects between 20 and 40% of people in both their eyes, although it's really unusual that it would start in both eyes together. And often when it affects the second eye, the person knows straight away, they can recognize the symptoms. So it's very important if one eye has wet macular degeneration that you maintain regular treatment. You want to maximize that vision in that eye in case the second eye becomes involved. But if you do have wet macular degeneration in both eyes, it's common to have injections in both eyes, and most people, believe it or not, have injections at the same time when they're having their injections.
Mark, wet macular degeneration, you have so much experience in the disease, and it can be a bit scary for people diagnosed with it. Is it hereditary?
Well, the thing about macular degeneration is we'll all get macular degeneration if we live long enough. The thing about the hereditary component, if you have a family history of macular degeneration, you will get it earlier in your life. But it's not guaranteed that if your relatives have it, that you'll get macular degeneration. So once you're over the age of 50, it's important to have your eyes checked regularly. But the good thing about macular degeneration, even if you have a hereditary component to it, is you can improve your outcome by looking after your blood pressure, not smoking or giving up smoking. And the thing about smoking is the more you give up, the better. And you can also make sure your body weight is optimal so that you exercise regularly and you're not overweight as best you can, of course. It's easy to say that, but not easy to do it.
So the patient's been diagnosed with wet macular degeneration. You're their physician. What's the treatment regime that they're going to experience?
Well, the treatment regime, believe it or not, is an injection in your eye. It sounds crazy. There's no other way to treat wet macular degeneration. The treatment injections need to be regular. The treatment itself is done with the needle under aseptic conditions where your eye is cleaned and numbed before the injection is done. You're lying down. You don't really feel the injection. The eyelids are opened. Make sure you can do the injection safely. And after the injection, you see what looks like an egg white typically in your eye. After the injection, you may have a dull ache, which can be relieved with paracetamol, but if you get bad pain, which is very rare, that's serious, and you need to tell your doctor or the team looking after you that if that happens.
So Mark, the patient's been diagnosed with wet macular degeneration. Can you outline what the regime would be and when the patient would see some level of improvement with their sight?
Well, the treatment with the injection starts with the loading dose of injections, which are 3 injections a month apart. And after that loading dose, you're usually reassessed by your doctor after the last injection. At that time, the vision has often improved, but it may continue to improve with further injections. And nearly everybody needs long-term injections, but the interval between the injections can vary. It can be as frequent as 4 weeks or as far apart as 10 weeks or more, but the average interval is 8 weeks. Now, in the long term, we're very good at keeping patients' vision really at a high level, but their injections need to be regular. So you can control the outcome by attending for the injections, letting your doctor know if your vision changes between injections, making sure that if you're going on holidays or are there any other events that you don't go too far between injections.
The patient has been diagnosed with wet macular degeneration and has embarked on a treatment regime. Are there any risks?
Well, anti-VEGF medicines have been around for 20 years, Chris, and the medicine is considered to be generally safe and effective. You do have risks with the injection into the eye. They include damage to the eye because of an infection or damage to parts of the eye, but those risks are very small and they're way outweighed by the benefits. The benefits are maintaining good central vision, maintaining your independence. And over the years, we know we can do that for long periods of time. And that has been a revolution in treatment of wet macular degeneration.
Mark, thank you so much for your time today. It's been so insightful and you've provided such a level of reassurance and insight into what the genuine fears of people with wet macular degeneration might have.
Well, I'm delighted to take the time because it's so scary to think about the injections, but once you explain what it's going to be like, it helps people face the injections. And once they have them and they see the effect on their vision, it makes it so worthwhile.
Thanks again, Mark.
You're welcome, Chris.